Hello everyone, we're the Lemon Pickers, and today we're doing our poster presentation on our systemic sclerosis project. And I'm Justin. I'm a current fourth year medical student at Hong Kong University, and Siraj is a fourth year science undergrad at UCLA. So first of all, systemic sclerosis is a rare autoimmune disease that has particularly high mortality in Asians, and its major clinical features include skin tightening, Raynaud's phenomenon, digital ulcers, and myositis, so on and so forth. Interstitial lung disease is the number one cause of mortality in patients diagnosed with SSC. The two major subtypes, as you can see in the graph, include limited and diffuse. And diffuse obviously has a more higher extent around the entire body and also in terms of organ involvement. Specific serologies associated with the disease include ANA, ACA, SCL70, RNA polymerase 3, and U1-RNP. And our main study aim is to examine the serology profiles and clinical manifestations of SSC in different ethnicities. We mainly used a retrospective cohort study method for our study that includes 338 patients from Stanford's dataset, and it includes self-reported races of ethnicity. Although all races include non-Hispanic whites, blacks, Asians, Hispanics, and others, but we excluded mixed race patients from the dataset. If you can refer to our results section, we mainly have four main graphs here, and they basically illustrate the different types of organ involvement, subtypes of SSC, and the distribution of autoantibodies of SSC in non-Hispanic whites versus Asians. Overall, in figure 2, we can see that Asians have a higher frequency of digital ulcers, myositis, GI involvement, cardiovascular involvement, and interstitial lung disease. And if you refer to figure 3, Asians have a higher frequency of diffuse SSC, which is the more severe clinical subtype at around 59% when compared to 33.5% in Asians. In figure 4, ANA was the most common autoantibody present, but SCL70 and RNA polymerase 3, which is the blue and yellow sections in the pie graph, are more linked to the SSC severity.
In terms of major findings, we noted that Asians have a higher frequency of diffuse systemic sclerosis and interstitial lung disease. Also, Asians have a higher frequency of SCL70 and RBA polymerase 3 antibodies than NHWs, but this did not reach statistical significance. With respect to limitations, we must note that the study was retrospective cohort study and also focused on one small single center, so you're going to have a lot of unavoidable missing data. Furthermore, the fact that race was self-reported can lead to misclassification. Overall, the study sets a good precedent in that Asians who have a more severe clinical phenotype with NHWs may benefit from more aggressive screening and monitoring for progressive skin and interstitial lung disease, and additional studies should be planned to evaluate the outcomes of SSC on top of the research that we've already done. Thank you so much.